All right. So Ashley Bergeon has worked in the prevention field for almost a decade, starting her career in St. Joseph County at CMH. At Community Mental Health, Ashley was the sole prevention provider in the county, coordinating the community coalition, as well as implementing in school prevention programs, as well as family-based prevention programs and prevention programs with incarcerated people and people on probation and parole. She began working at Prevention Works in 2015 in Kalamazoo. At Prevention Works, Ashley has coordinated the community coalition, managed the drug-free communities, and stopped underage drinking grants, led the youth coalition, and piloted the policy and advocacy work at the organization. Ashley has partnered with MCRUD for most of her prevention career, including serving as the former chair. Ashley graduated from the Ohio State University. I want to emphasize that. Oh, Curtis is, I think, is Curtis giving a shout out too? No, I think it's going like that. So among other things, though, in addition to that, I do know she's also serves on our local library board like I do, so we have that in common. I know that I've seen her coalition in action as well, and they do a great job. And it was great working with her on this project she's going to talk about and other things as well. I also want to appreciate Ashley for changing time slots with Joel so he could do his coaching. So thank you for that. We just learned she has two cats named Belle and CB as well. I know that she likes Fort Custer State Park because we've talked about that in the past. And I didn't know this, but one of her favorite bands is Guns N' Roses.
What?
I made that part up. Maybe not. Maybe that was
Like,
my
when did I tell you that? Because that's untrue. I was lying.
No, I made that part up. But anyways, turn it over to you, Ashley. And we didn't ask you this before, but do you want questions throughout at the end? Do you have a preference?
If people do have questions, you can just unmute yourself and shout out the questions. I won't be able to keep an eye on the chat, but I'm happy to take them whenever. And on the note of favorite bands, RIP, the drummer for the Rolling Stones passed away today. So Charlie Watts. So that's super, super sad for me because I'm a huge, huge Rolling Stones fan and I saw him a few years ago. So I'm going to share my screen here. I know this is like the last presentation of the day. And so I probably won't take up the whole hour. I know it's always difficult on the last hour of the day to pay full attention. So you get this pulled up. All right. So today I'm going to be talking about our Kalamazoo alcohol outlet density project. As Mike already mentioned a few of these things, here is a little bit of work that I have done, so I won't spend any time on that. So Mike and I started working on this outlet density project in May of 2019. But if I recall, the conversations around this actually, I think, started in the fall of 2018. Mike came to me and said, would you be interested in partnering on this type of a project? And I said, yeah, I would definitely be interested. And then I think Mike worked really diligently to find funding for it and landed with some OROSC funding. So once that was all solidified, then we sort of formalized our project. So I had initially said yes, not really knowing what an outlet density project was. Mike was like, oh yeah, it's this thing where you look at alcohol retailers. I was like, cool, sounds great, let's do it. So I went into the project really not entirely clear of what I was getting myself into, but really excited to start it. So we brought it to our coalition in May of 2019, and then we had several other partners join on. Our original goal, I would say the goals that I've listed on here are probably a little more specific than we knew when we got into it. I think our original goal was just see what happens. And so we wanted to study outlet density. We knew we wanted to study some kind of related harms. We weren't sure what that was or what that meant. And then figure out how we're going to utilize this and leverage it potentially an opportunity for MCRUD to replicate the project throughout the state, and then utilize the study for policy change at the state level. So that was kind of what we jumped into. Those goals weren't very clear. We didn't really know what we were doing, and we were really building the bike as we were riding it, which was really fun and offered us a great opportunity to really learn. And I think we actually had a really solid project. And you would think that we knew what we were doing. So why an alcohol outlet density study? Why did we do this? Why did we go into this work? Well, we started learning that there were a specific number of amount of alcohol retailers a community could have based on population, which are called quota licenses. And then we found out, well, that's a little trickier than that. The state had started to add different types of licenses outside of your on and off premise retailer. So on premise being your bars and restaurants, off premise being your stores. And so these special licenses included resorts, microbreweries, festivals. Some of them were temporary licenses, some were permanent, but those were not subject to the quota. So the quota only applied to the original licenses for sales, manufacturing, or on-premise, off-premise sales and manufacturing. And so you had this addition of more licenses. And then to make it even more complicated, neighboring cities could kind of move licenses from one location to another. So I could purchase a license if it was open. If Portage here in Kalamazoo County had open licensing, I could purchase one there and I could transfer it to Kalamazoo City, which may have already hit the maximum number of retailers it could have. And then we started to see the state move towards deregulation. They getting rid of the half mile rule maybe 5 years ago now, maybe a little bit longer, which got rid of the half a mile distance that had to be maintained between retailers. The push this last year that everybody knows about to move to 4 a.m. sales at bars and restaurants, social drinking districts during the time of the pandemic. And then this proliferation of more non-traditional places selling alcohol. We started seeing it in movie theaters, bookstores, coffee shops. But now we're seeing it in zoos, ice cream shops. These are the kind of new places are regularly coming up. So we were realizing as we started jumping into this, there really is a need to understand what is happening, not just at the state level with these policies, but how is this impacting our community? So we started with a CDC study that was done in Buckhead, Georgia. This is one of the most extensive studies that's been done on alcohol outlet density. I put a link in the presentation. So when Mike posts that, you'll be able to have access to that link so that you can pull it up. But this study suggested that the higher the outlet density, it is associated with higher alcohol-related harms, and particularly violence. And so over 5 years, the CDC studied outlet density and violence in Buckhead, Georgia, and saw that at the very end, when they had a 3% decrease in alcohol outlets, they had a 28% decrease in violent crime. So they were showing that there is a relationship between these two. And even when you decrease retail outlets by a very, very small marginal amount, you see a very massive difference in that violent crime rate. So that was kind of where we started, and we thought, okay, we think we know where we want to go with this study. So after Mike had secured the OROSC funding, we brought the idea to the coalition to get buy-in from the project. I think most people here work with coalitions, so you know that the most important thing is making sure that they're on board before you jump into a project. So we presented the idea of kind of what's happening, the landscape around alcohol policy in the state. We presented the Buckhead, Georgia study and sort of a broad outline of what we wanted to do, and the coalition was fully on board right away. So our very first step was to pull all of our current liquor licenses from the LARA website. I included the link there. It can be a little bit tricky to find unless you have the exact link, but you were able to pull up by county and by city all of your active licenses. So we took that list, we cleaned it up. Some of the retailers have multiple licenses. So we made sure we didn't have duplicate retailers in our list. And then we had the coalition visit each retailer with a really simple form, because essentially we first wanted to make sure that we had this list correct. We wanted to make sure before diving into this project, is this list accurate? Is it up to date? And so the coalition took a really basic form, verified retailer name, address, phone number, if they were on off-premise sales or both, and then the type of alcohol they sold, so beer, wine, and liquor. Very, very easy. They maybe had to be in each retailer a total of 5 minutes. So we did this over 2 months. Everybody was assigned, I think it was 10 retailers a month that they literally went into to physically see. And while they were doing this on the back end, Mike and I still weren't fully sure what we were going to do with this project. So we started throwing out several ideas, but it seemed like the thing that made most sense was violence and outlet density, because we already had studies that show that these two things are related. So we hopped on the phone with the CDC and said, hey, we need some technical assistance. How do we do this? This is what we're thinking of. And they said, okay, slow your roll. I know you want to do this whole Buckhead study, but this was a massive research department that went out and did this. This was over 5 years. They had historical license data. We think you're in a little over your head. And we said, you're probably right. So we went back to the drawing board. We said, no, we still think we want to do violence and outlet density. Let's see what the state of Michigan has in terms of historical licenses. So when you go to that active link that I had on the previous slide, you can pull up current licenses. And we asked the state of Michigan if they have historical licenses. So could we maybe look back 5 years? How many outlets were there? Where are they? And then compare now to 5 years ago. Well, we found out they didn't keep historical liquor license data. They only kept point in time data. And so he said, okay, so longitudinal study is out. We're just going to do point in time. So we stuck with current alcohol licenses. And it was in 2019. So it was, when we pulled that list, it would have been May 2019, May or June 2019. So we were studying it from that point on. So we were doing the Buckhead study, but not longitudinal, much more condensed version. We also decided for sure we're going to look at violent crime. We are really lucky to partner with our local police department that are strong coalition partners. And so they gave us a list of all violent crimes in the city for a 1-year period. And I'll show you in a little bit what that looks like. Once I'm done with the slideshow, I can pull up that document. So we figured, okay, this is a really good starting point. So at this point, we worked with the alcohol epidemiologist for the state of Michigan to create some basic maps for us, plotting crime and alcohol retailers. Our police made it really easy for us. When they sent us the crime data, they actually sent all of the latitude and longitude coordinates, so that at the time, Pat Hinman, who was our epidemiologist, was able to just plug those in and map them. So he didn't have to do any work at all other than plug it in. So I am very thankful for our police department for doing that legwork for us. But once we had these maps, we really didn't know what to do with them or how to tell if the two things were related. We didn't have the tools to create analysis for that correlation. And all we had was dots on a map, and we could kind of look at it and go, okay, we think some things may be related, but this isn't really scientific. So Mike had a relationship with Rick Sadler at Michigan State University for some technical assistance on some mapping. What Rick wound up doing is going far above and beyond what we thought he would do in his partnership with us. So he created maps for us looking at several indicators and analyzing the correlation. He collected information about where children live in the city of Kalamazoo, race demographics, and levels of distress. And then we also, Rick said, hey, it would also be cool to look at the relationship between food and alcohol retailers, food access and alcohol retailers. But he didn't have that information. So we went to the Michigan Department of Agriculture and Rural Development, MDARD, and asked them for a list of food retailers in the city of Kalamazoo, food licenses. And they provided that really quickly. We actually thought it was going to be much more complicated than it was because they didn't have a site like Lara where you could just go and pull it up. And when I emailed, they said, we consider that a FOIA request, fill out this form. And I thought, oh no, this is going to be probably a giant pain. This is going to be a complicated situation. Within 24 hours of submitting that form, they had that list to us. So it was extremely easy. So I'm going to walk through some of our maps so you can see what they look like and then what some of those correlations were and what we found through this mapping process with Rick and Pat. So this was our original map. So this is the outline here is city of Kalamazoo. So everything in here is city of Kalamazoo. And then you can see that some of these, the purple dots are our on-premise retailers, the red dots are off-premise retailers, and the yellow dots are the combo of on and off retailers. So this is kind of that first map that we started with that Pat had done. And like I said, you can see some concentrations of where some of these retailers are, but we really didn't know what that meant. So then what Rick did for us was he mapped some of the crime, the highest crime density areas in the city of Kalamazoo. So you can see that there are two kind of primary neighborhoods. The darker the color, the higher the crime rate. Two primary areas in the city of Kalamazoo. This is in the east side neighborhood and this is the north side neighborhood. That was not very surprising to those of us from Kalamazoo. Those were the two kind of pockets that we assumed. This is what our map for children looked like, where children live in the city of Kalamazoo. So you can, again, the darker the color, the higher the density of children who live there. Most of those happen to be outside of the city limits, except for kind of up here. What you see in white here, I believe some is Western Michigan campus. So you're not going to see kids living there. So this is what our map of that looked like. And then he looked at food availability. So these are just the initial maps without any correlation or relationship. Food availability, he had several different categories of food availability: supermarkets like your Walmarts and Myers, grocery stores, convenience stores, ethnic food stores, dollar stores, and pharmacies. What he found was really actually quite interesting. Access to grocery stores in Kalamazoo is not as unequal as we see in some other cities. These stores can be found in many different neighborhoods based on socioeconomic distress level. The only supermarkets in the area are, however, on the western and southern edges of the city, which are predominantly white. And then this is distress. I'm going to read how they came up with the distress level and act like I am really fancy and educated and know what this means. It was computed from unweighted sum of z-scores of 4 variables that predict material and social deprivation. So that all flew over my head when he told us that. But essentially, it is looking at low educational attainment, low income, unemployment, and lone parenthood. The higher the score denotes the more distress. So then you see the darker areas are your higher distress areas in the city. So again, you kind of see it in that north and east sides of Kalamazoo City. So then what he started to do is combine those maps and look at the relationship. So I didn't include all of the maps that he created for us because there were like 20 something maps. And when he sent them, we looked at them and we were like, what do these mean? Because take off the the descriptor on the left-hand side of your screen. And if you look at that map, you're kind of like, I don't really know what I'm looking at. And so Rick and his team were great enough to offer a little too long didn't read description of each of our maps, so we knew what they meant. So with children and alcohol availability, looking at where children live in relation to where our alcohol retailers are, we found the neighborhoods with the fewest children tend to have more on-premise alcohol outlets, so more bars and restaurants. But our off-premise outlets can be found in neighborhoods with more kids. So that one was really concerning to us when we think about access and we think about how much people are exposed to alcohol messaging. If you live in a neighborhood with a lot of kids, they may be exposed to a lot of alcohol messaging through alcohol retailers. Alcohol retailers and food. Food access and alcohol outlet location don't seem to be strongly correlated, but the presence of some healthy foods at off-premise alcohol outlets suggests some connection. And so this was really interesting. And I know Rick was particularly interested in this because this is some work that he and his team had also done or were going to be doing in Flint. The boss of his department, Dr. Deborah Verholden, had come from Johns Hopkins, and in Baltimore, they had done a huge alcohol outlet density study. And we're also working to reduce the outlet density in the city of Baltimore. And she had come to speak to MCRUD. I want to say it's been 3 or 4 years now since she spoke at MCRUD at a meeting in Flint. But when they had studied that, they had talked about getting rid of some of the alcohol retailers in the city of Baltimore, but they got a lot of pushback. And the reason they got a lot of pushback was because a lot of those retailers were the only places that sold food in some neighborhoods, particularly neighborhoods that were predominantly Black and predominantly poor. So those folks didn't have access to large grocery stores and healthy foods. They typically had convenience and party stores that sold both alcohol and food. I think another really interesting piece that we haven't looked at yet is looking at the footprint of alcohol within stores. So what I would be really interested is that stores that do sell both alcohol and food, knowing if those stores have a large footprint of alcohol in those stores. So in higher income neighborhoods that have grocery stores, alcohol may be sold, but it's a small amount of what they actually sell when you look at the size of the store and the amount of merchandise they have. But in neighborhoods that have higher distress, typically packaged food is sold at convenience stores, and convenience stores are much smaller, and alcohol may take up a larger portion of their store. So that's something that I'm really kind of curious and interested about, but we didn't dive into that in this study. Looking at alcohol and distress levels, the poorest neighborhoods tended to have the fewest on-premise outlets, so the fewest bars and restaurants. Those tended to cluster in neighborhoods of average distress. And then what was also interesting was the wealthiest neighborhoods also did not have a lot of on-premise retailers. So two kind of very different reasons that I am hypothesizing that they have very few on-premise retailers. So typically in poorer neighborhoods, the reason they tend not to have a lot of bars and restaurants is because those bars and restaurants likely don't view those as desirable neighborhoods to go into. And the reason they tend not to be in the higher income neighborhoods is because those communities have typically the ability and the resources to advocate against retailers being in their neighborhoods. They did find that off-premise outlets can be found in all types of neighborhoods, with some clustering in the poorest neighborhoods. And we do know that our East Side neighborhood does have quite a few, as well as our North Side neighborhood, based on the areas that those neighborhoods cover. So those are our two poorest neighborhoods, and they do have a lot of alcohol outlets. Interestingly enough, just to kind of go back to this, so there's my cat speaking, if you can hear him. Interestingly enough, we did a survey in our East Side neighborhood. So one of our neighborhoods that has high distress, high population of Black folks, high crime rates, and a lot of alcohol retailers. What people told us is we have too many liquor stores in this community, but we don't have enough bars where people of color feel comfortable congregating. And so we found that really interesting because that let us know that they are still looking for some sort of a social place where they feel safe and comfortable going that isn't dominated by white folks and that aren't located in predominantly white areas. And so that's kind of a thing that I think that we need to discuss. And it doesn't necessarily have to be places that sell alcohol, but I think even just having safe social places for people of color in our community. So alcohol and race. On the left-hand side is population of Black people in our community. Right-hand side is our Hispanic population in our community, related to our alcohol outlet density. So the two race maps suggest that predominantly African-American and Hispanic neighborhoods north and southeast of downtown may explain clustering of off-premise outlets and the absence of on-premise outlets from those places. So again, saying that our poorest neighborhoods that have the highest population of Black and Hispanic people also have a very high population of off-premise alcohol retailers. So a conclusion from the maps overall, some of the indicators didn't show a strong correlation with alcohol and the harms that we looked into, and others did. But really at the core of this is areas that have high distress really don't need additional alcohol outlets that can exacerbate the harms that those communities already experience. So what are we going to do with this? What are we doing with this? Next, we are going to be working on conducting focus groups and stakeholder surveys to gain a better understanding of these communities and the challenges that they experience. This is a process that we are going to be starting this fall. We've actually hired diversity and equity evaluators. We recognize that in the past, when we've conducted focus groups and stakeholder surveys, what typically happens is we drop into these communities, we collect information from them, and we leave. We aren't trusted people in those communities. I'm a white professional woman going into a predominantly Black community. I don't look like them. They're going to be understandably a little leery of giving me their information. And I'm also in a way using them for their information. And so we are trying to flip how we do evaluation in our organization by working with actual diversity and equity evaluators to learn how to do more equitable evaluation. So this includes training people in those communities to actually host and conduct those focus groups. It also includes paying folks for providing us with information. And so that is a giant project that we're going to be starting, but that's one of our kind of next steps to really round this out, because we have this quantitative data that I've just presented, but we really don't have the qualitative piece. Other than a small survey that we conducted. We have a youth team that we want to conduct an environmental scan. We're not really sure what that is going to look like at this point, whether we're going to do kind of an environmental scan of social drinking districts, community events and festivals, if we're going to do kind of their everyday impact of seeing and interacting with alcohol, advertising. So that's something that is on the horizon, but we haven't figured any of that out yet. And then once we're done with all of this, we really want to create an advocacy plan. I don't know what that advocacy plan will look like because we haven't completed this project, but I threw up a few ideas of things that we definitely will be keeping in mind for our advocacy plan. Advocating against permanent social drinking districts. I think that's one that most of us on this call can agree that we don't want to see. Advocate against new license types as the state continues to add license types. That adds the amount of alcohol retailers that we have in our communities, and we don't need more. Advocate for historical licensing data to be maintained by the state of Michigan. Alarm bells went off in my head when they said we only have point in time. We do not collect historical data. And I really thought, well, wouldn't you think that would be an important thing so that we can understand where we've been and where we're going? Mobilize the community against new licenses and create stronger compliance check programs. I was really excited to hear the compliance check presenters that spoke last week at the very first day of the coalition, because it gave me a better sense of really how to do a fully evidence-based compliance check program. Potentially, we could replicate this in 5 years to see what has happened if we've increased the number of outlets or decreased in what's happened to our crime rate in that time. And I think a lot of us are really interested in cannabis retailer density. Our community does have cannabis retailers. It feels like a new one is popping up every week in the city of Kalamazoo. And so I would be really interested to study if those retailers are taking a page out of the alcohol playbook and congregating in marginalized communities and exacerbating some of those harms. So before you dive into these projects, first and foremost, I think about the length of the project. We're currently 2 years into this project and it's not yet complete. So like I said, we have the quantitative data piece finished, but we don't have the qualitative. We don't have from the community what they're seeing and hearing. And so it has taken us about 2 years to get to this point in the project. It was about 1.5 years from start to finish, between starting the project and visiting those retailers to having those maps finalized. So that in itself was 1.5 years, and then an additional 6 months in trying to figure out how to conduct these focus groups and do some of this diversity and equity inclusion work. The next thing to really think about is what data does your community have available and what data can you easily access? The best thing when you're starting out is really think about what are those low-hanging fruit that you can easily access. You don't want to go for data that you're either never going to be able to get or is going to take you 2 years to get, because you know the process itself is going to be an hour or a 1.5 year project. You don't want to spend a year also trying to collect data. We are very lucky that we have a really strong relationship with our police department in the city of Kalamazoo. And on top of that, that they have a really strong data collection and analysis department. And so most police departments don't collect data the way they do and as much as they do. And most police departments are not as forthcoming with their data. And so with this, like if we wanted to do this study in one of our other cities in the county, like Portage, they don't have the data programs that Kalamazoo City Police did. They actually have to pull by hand each of those files. And so their data just isn't robust enough. So that's really something to think about as you kind of embark on doing this type of a project. Also think about partnerships needed for this type of project. Data collection is, what kind of partners do you have for certain types of data? Mapping, we were really lucky to have Pat Hinman, who was sitting in the alcohol epidemiologist position, which now no longer exists as of September 30th in the state of Michigan. And so that won't be there. Technical assistance, do you have researchers that can kind of help guide you in this project and answer questions. What is great with this group is that we now have several of us who have participated in this, including myself, including Mike. And so we are able to offer some of that technical assistance. Mapping, we were really lucky to have Rick Sadler, who donated his time and resources actually well above and beyond what we ever thought he was going to do. We actually kind of thought he would consult a little bit on the project, and he dove in head first. I don't know what type of time he has to bring that to other people wanting to replicate this project. Some health departments are able to do some mapping. It depends on the health department and their capabilities. I know at one point Kalamazoo Health Department had some mapping capabilities, but maybe not as complex as the ones that Rick was able to provide. So working with your local health department might be a really good place to start to figure out what they can offer you and what they can help with. These are all of the people who made this project possible. So you can see it's not a small list. Obviously, Michigan Coalition to Reduce Underage Drinking and Prevention Network is the lead on the project and obtaining the funding. OROSC is our funder. My coalition, Kalamazoo County Substance Abuse Task Force, as the ones who are doing the legwork locally. State of Michigan Alcohol Epidemiologist for mapping and research, Lara and MLCC for a list of licenses, MDARD for food licenses, Michigan Department of Public Safety for crime data, Michigan State University for mapping, CDC for technical assistance, and Change Lab Solutions for advocacy and legal technical assistance. So it's a pretty large list of people that we needed to make this project as successful as we were able to make it to the point where we did. I'm going to stop sharing, and then I'm going to show you just what that data collection document looked like from Kalamazoo Department of Public Safety, just so you can see what they gave us. So this is an entire year of violent crimes in the city of Kalamazoo. They gave us way more than we needed. So they gave us case number, crime description. We utilized what they did in the Buckhead study, which were FBI level 1 violent crimes. They actually gave us all of the information about the statute and crime code, date, time, street address, and then the most helpful part for the mappers were this latitude and longitude that they had already in there for us. So this is a pretty helpful document if your police department does any data analysis work. So does anyone have any questions?
Hey, thank you, Ashley. I'm going to stop recording.